Imaging probably represents the best way of diagnosing and managing, in fact, a vertebral fracture. X-rays are commonly used and they're very easy to do and they're very good at diagnosing a vertebral fracture. However, it doesn't always tell us how to treat them, and for that an MRI scan is often the better test to do. The reason is that the MRI scan will show us not only the broken vertebra but the relationship of that broken vertebra to the surrounding structures, including the spinal cord, the discs and the nerves. It will also tell us how bad the fracture is and how likely it is to heal, and that will determine whether we need to do something about the fracture. Many fractures can be treated non-operatively. We can often give painkillers to the patients to help with those symptoms, and we can often supply a corset or brace to provide an external support to the vertebra to allow the vertebra to heal. Sometimes the fractures are more serious, and in those conditions I often need to reconstruct the spine to make sure that it is stable and solid and will allow the patient to weight bear. And that's often done with a combination of using screws and rods, and sometimes we will use some cement that we can actually inject into vertebra to provide some instant stiffness to the vertebra, and that often relieves the symptoms. In older patients where the cause of the fracture is often due to osteoporosis, we often use a cementing technique. This is a very short operation, usually lasting about 30 minutes, and can often be done under local anaesthetic. What it involves is injecting into the back a small amount of cement which goes into the broken vertebra, uniting all the parts together and making it solid. There are few operations in spines that produces dramatic results, and this is one of them, where for a short 15 to 20 minute procedure, the patient can often walk out of surgery and go home just a few hours later.